Because most love pet health coach. And what I'm going to talk with you about today is what to do when your pet has cancer. You're trying to get some answers, but you can't get in to see an oncologist for weeks. I had hoped Dr. Venable was going to be able to join us, and she's unfortunately had some technical issues pop up. But I wanted to let you know about her service, and hopefully she'll be able to jump on in a few minutes with us. So let's start with what she can offer. And the thing is that if you've had this experience of trying, if you've had a pet that's, here we go, developed cancer and you're trying to get some answers, whether to find out, do I even want to pursue conventional options for therapy, or do I want to just try and take things natural route? It can take weeks, like 6 weeks to sometimes 2 months to get an appointment with an oncologist. And part of the issue is that there are 450 boarded veterinary oncologists with over 6 million dogs diagnosed with cancer each year. So, what Dr. Venable did was develop this service to help support pet parents and work with local veterinarians so that dogs can get care for their cancer in a much more rapid way. Um, the idea is that you may live, many miles away from a veterinary oncologist with no access to care. Excuse me. Um, and so you can schedule a consultation with your veterinarian and with Dr. Venable. See if that works, to get some sort of answers, get a handle on what is going to happen. Excuse me, what the prognosis is, and kind of the things that um, excuse me, that sorry guys, I get this cough is just not relenting. Um, so at any rate, it's designed to help us help our pets in a more quick manner. And I'm sorry, I'm trying to help Dr. Venable get online. Our software is being a little stupid, so if I bonk off, I'll be right back. Thanks, back here now, and I'm not sure why it's not letting her in. Um, so let me try and message her real quick. So the whole deal is, how can we actually help these guys? Sorry for the shenanigans, but it is what it is. So how can we actually help our pets get through this cancer diagnosis? So we'll give Dr. Venable a couple of minutes to see if she's able to jump in or not. And in the meantime, I'm going to give you a couple of my best tips, one of which is to take a deep breath and try not to be totally freaked out, because I think our pets kind of feed off of what um, our emotions are. And looks like Dr. Venable's able to get in here with us, which is awesome. Wonderful.
Hi, sorry about that. My
Not
computer problems.
it it is technology biting us in the behind again. So everybody, welcome Dr. Racheal Venable. I was trying to sort of stumble my way through through explaining what you do, but Dr. Venable is a boarded veterinary oncologist, and what that means is that she has done the regular 4 years of veterinary school, plus an internship, plus 3 additional years of residency training and on and on and on. So her knowledge is just phenomenal. The other thing is that she's was her cum laude in her veterinary school class. She had her internship at the University of Georgia, and then did her residency at Colorado State University's Flint Animal Cancer Center, which is probably the premier veterinary cancer center in the country. And love Dr. Ogilvy. He was one of the first to pioneer the idea that perhaps nutrition and supplements have a place in oncology. So, welcome. Glad you could get on. Sorry for all the technology shenanigans, but here we are. So, um, what I was doing is kind of showing folks your site, and this was born out of the frustration that so many pets and dogs especially develop cancer, but there are so few veterinary oncologists and really not much in the way of access for many people, especially if they live in rural areas, to get care for their pets. And so the goal is for you to work with both the pet parent and the local veterinarian so that the pet parent can get the information they need to make decisions about care for their pet, understand what the prognosis is, and and also what a treatment plan may look like in the conventional sense. Am I summing that up pretty fairly?
Yes, yeah, yeah, exactly. It's trying to help. There's that real gap in care for a lot of people where, either it's geography, like there's just nobody, the whole state of Nebraska doesn't have an oncologist, Arkansas, there's actually North and South Dakota, like there's a lot of places where there isn't an oncologist. And sometimes even in the large cities, there's just not enough oncologists. So that can be, the issue as well.
Right on. I mean, when I finished veterinary school in 1990, it was still the Wild West, and in fact, I think oncology was just sort of coming to the forefront, and it really I think it had just received a separate designation under the American College of Veterinary Internal Medicine, but it was still relatively new. So I was out there trying to solve cancer cases and doing, I'd call up the folks at NC State and say, "Hey, what do I do about this?" And they'd be like, "Okay, we'll do this and this and this." And those drugs are not non-toxic for sure. And so I'm sure that I expose myself to stuff. And this is part of the issue is that if you decide to go the route for intravenous therapy for your pet, you really need to be working with somebody that's in an environment where they can keep not only the pet safe but themselves and their staff as well. So that's kind of the other part. But you're able to come up with a myriad of plans. So working with local vets. So talk about that a little bit.
Yeah. So as you mentioned, IV chemo, especially, you have to be careful with handling. We don't really know, but there's a lot of concern of risk as far as if you're handling it on a regular basis, could that increase your risk to cancer? There's a lot of fertility that has been more proven that there's fertility issues. So yes, there are now more guidelines, and actually more than guidelines, there's rules now. And so not as many vet clinics are handling IV chemotherapy compared to years ago, before that. But there are different plans. IV isn't the only thing. There's a
Right
lot of
on.
different oral. And with the oral, you don't have to have special handling, not to the extreme that you do with the IVs. You still have to be careful with it. Wear gloves, be careful. It's kind of like anything where you don't want to touch it and then touch your face, right? Like you have to think about those sort of things and storage. But yeah, there's IV chemo. There's more targeted therapies. So that's something that's coming out more in people and trickling down into our dogs. So that's where we're trying to get more of those individualized treatment plans. And so those are more options now. And sometimes it's a combination of things too, the IV and the pills as well. But yeah, there are different options. And then there's always hospice. That's certainly something with cancer. There's a lot of situations where we're not looking at cures. So how can we just keep them comfortable? And a lot of times that can involve different pill medication and things.
Right on. That makes sense. And then one of the things that I did used to do when I was still in practice was metronomic chemotherapy. And that was astonishing for many of my patients. And so the concept there is to use small doses of chemotherapeutic usually oral medications. And the goal, again, not to cure, but to just palliate or kind of calm the tumor down so it's not growing so quickly. So, and that's another possible care plan you might come up with, depending on if that's appropriate for that patient or not. So, so that is super awesome. Sorry, this cough is just not relenting. Um, so, so that is fantastic, and I know that you've been working with folks in rural areas and working with their vets. And then another problem you're facing is trying to get other oncologists to work with your clients for the IV portion. Can you kind of speak to that a little bit?
Yeah, so, there are some cancers where IV is really the best treatment. And so it's something where, I talk with pet owners, we go over all the options. But the ones that want to pursue IV, as I mentioned, a lot of family vets aren't really doing that anymore because of the OSHA regulations. And so then it's trying to streamline them into an oncology clinic where they can get it. So I'm based in Arizona, so I've got an oncologist here that I work with really closely, and that's something that's worked out quite well for all of us. As far as, it's something where I can do the consult and then she'll get them in sooner for treatment. She doesn't really have those openings for consults. Unfortunately, she's booked out a couple months, honestly. It's quite far. So, but this is a way that she's comfortable to get them in sooner as long as they've talked with me and we've gone over everything. So that's something, it's almost like she has another oncologist on staff, but not kind of the same for me. It's like I have another one on staff. So it's just this nice partnership so we can
Right
help
on.
get people in.
Right on. So, for those of you that have worked with veterinary oncologists in the past and you know that they are just absolutely overwhelmed, I've dropped Dr. Venable's site here in the comments. And ask them to reach out to her, because this is a way for other people's pets to be seen and to have the options presented to them and then streamlined into a treatment area, much like, really, this is what happens on the human side. You go to the oncologist and then you go to the treatment center, and unfortunately that's not really happened on the veterinary side. We all want to do everything ourselves. So, right on. And then, as you said, sometimes we're in a hospice or a palliative care situation, and that's where what part of what I do can be very helpful. We can help improve the pet's quality of life. You can work with your local veterinarian to get medications that are going to improve comfort, and really, that's the whole thing. It's not, at this point, not quantity of life, but quality of life. So those are all great options. So there's several questions that folks have asked me to ask you, so I'm going to fire away at you a little bit. And I mean, I've got some of my own theories on this, but why do you think there is so much cancer we're seeing right now? I mean, it's ridiculous. We're seeing, what, almost 50% of dogs by the time they hit 10 will develop cancer?
Yeah, it's something like that. It's crazy numbers. Dogs actually have a higher incidence of cancer than people, is what it's looking like. There are a lot of different theories. I think some of it, we're taking a lot better care of our pets than we used to. They used to be backyard dogs and they would pass away from, a lot of times infection or that kind of trauma, whatever. The kind of the same with people. If you think, a couple hundred years ago, cancer wasn't the leading cause of death, right? And even now, I believe heart disease is still, at least in the States, I believe it's still heart disease, but
It is.
cancer is right up there. And so I think some of it's we're living longer. We're able to help, treat infectious diseases and different things like that. But there's always that question of exposure, right? What are we exposed to? And I think our pets are a great sentinel, if you will, like a great, because they live right with us. They share a lot of the same things, right? A lot of the same foods and what we're exposed to in our house. And so there's actually a study going on right now. It's called the Golden Retriever Lifetime Study. It's been going on actually for several years, but their whole goal with that study is they're following dogs throughout their life, the Golden Retrievers. So they get enrolled when they're quite young. I want to say a year or less than a year. And they have to, there's some pretty strict check marks that they have to follow, so that essentially we can get all this data to see, can we find any commonality here? Why are we seeing more of this? So they've started producing actually a little bit. They published something recently where actually they found a lot of golden retrievers were dying of hemangiosarcoma, which is a tumor of blood vessels.
Yeah.
We see it a lot in the spleen or the heart, but I was kind of surprised by that. They're not the breed that I typically think of for that. We do know they have a higher rate of cancer. So it is interesting, and I think we're finding with the Goldens how much of a genetic component it is. And so I wonder too, in people, how much more, because we know cancer actually starts in the genes. It starts with your DNA. So is some of that just what we're born with, or is it because it gets mutated and exposed over time? So yeah, it's kind of one of those, it's a really interesting, very fascinating, but we don't have a lot of evidence at this point.
And that's true. And I mean, really, UC Davis is the group that started looking at, that they looked at golden retrievers and their medical records in that first study in 13, and they made an association between spaying and neutering and the higher incidence of cancer. But that's interesting that the golden retriever study is reporting hemangiosarcoma as one of the primary cancers that's killing goldies. And I'm a little surprised by that too. That's because God knows they have enough other problems, but that's a horrible cancer. So yeah, I mean, if you could answer that question fully, you would have won a Nobel Prize because that's the holy grail. What's really causing all of this? And indeed, it is seems to be multifactorial. So one of the other things that people are asking is, can you prevent cancer? And I think part of the answer is in what you just said. It's multifactorial. So it's genes, it's environment. So have you got any tips that you think really do work?
Well, I mean, a lot of it, um, I think sadly is out of our control, even in people. I've known and had a lot of young people in my life that have gotten cancer. So I think some of it is just good health care, right? So like if you take your pet in regularly for rechecks, you're gonna hopefully catch something sooner than later, right? Versus if you never do. And then, I do think, eating healthy, right? If you eat a lot of processed foods, not to say that that necessarily causes cancer, but we know it causes a lot of health issues. And, in people, we know when there's a lot of inflammation in the body, a lot of obesity and things, that does seem to be related to cancer. And I can't imagine why that would be different in our dogs, and our
Right.
cats. So I think just trying to take the best care of yourself that you can. I mean, unfortunately, it's not a guarantee, I do think there's a genetic part that sometimes is out of our control, but I think that's really the best you can do in what I've seen. I also think when you're talking about dog breeds, you do have to be prepared. If you get a boxer, if you get a golden retriever, their chances of cancer are a lot higher. It's not a given, but if you get, a mixed Heinz 57, from a genetic standpoint, maybe you'd be a little bit better. But again, I think there's still unfortunately so much out of our control. I feel like cancer is kind of that great equalizer, right? It doesn't matter who you are, how you live, rich, poor, whatever, it can happen to you.
Exactly. And I think you're right. I mean, on the human side, it's crystal clear that there are a lot of things that we used to consider as genetic cancer, like breast cancer, for instance. And now on the human side, it's clear that actually 90% of the breast cancer cases are due to lifestyle choices. And so there is a lot we can do as far as making sure our pets are exercising, making sure that they're eating high quality pet food. I know this flies in the face of conventional veterinary medicine, but I'd suggest adding a lot of veggies, and personally, I think home cooking is the one of the best ways to go. So I think there's a little bit we can do to support, but as Jacqueline Onassis famously said when she was diagnosed with cancer, if I had known that, I wouldn't have eaten all those vegetables. So, so some of it is it just is. So yeah, thanks. And again, if you knew the answers to that one, you would also have another Nobel Prize on your list. And one of the other thing I'm getting questions about is the cancer tests like Pet DX. I think they're marketing to pet parents and like, go talk to your vet about this. So some of these tests in the past have really not been very helpful. But it sounds like maybe we're getting some improvements.
Yeah, and I would agree with what you said. It's like with anything new, you always need to do a little bit of your research, right? I mean, I do think sometimes things come into the pet market because it's a little bit easier than the human market for sure, and so you want to make sure that this is all, is it really worth it? And I do think Pet DX, like you mentioned, they've definitely done a lot of research. I've actually worked with that group, kind of learn more about their product and things, and so I think that's a good test to me. So when you have an older dog, so what they are recommending is over the age of 7, because some studies have found basically from 8 and older, the risk of getting cancer is much higher. So if we're trying to catch it sooner, that's why they mentioned 7. And then certain breeds, if you have a boxer, they certainly recommend checking them younger. But I think too, but with doing this test, the what you're trying to figure out is, does my pet have cancer somewhere that I can't obviously detect, right? So the whole goal, and they're actually looking at this in people, different company, but trying to see, can we find cancer at a really small level before it starts to really affect the body? Because the thought is, if we can catch it really small, then hopefully we have a better chance of treating, and so a longer, better outcome. And so I think when you do these cancer screenings, you have to be prepared. One, do you want to know? Right? Because there are some people that don't want to know, because right now we're in the early frontier. So if you find out your pet has cancer, then you're going to want to do testing and treatment, but will they necessarily live longer? I mean, that's the hope and the goal, but we're still learning on all this. And I've definitely ran into people who just don't want to know. But the other thing is, if the test comes back positive, you do need to do some more testing, right? So usually that's imaging. So like X-ray or ultrasound or CT, if you have access to that. There are some that it comes back so you can get a false positive. It's pretty low with Pet DX. That false positive is in that 1% range. And then when you look at statistics more of like what is the true, what's something called the positive predictive value, it depends on the population you're looking at. So if you have an older dog, then that false positive or that range, it's still fairly low if you get a positive. If your dog's already sick, so sometimes they offer, well, if you can't really find the cause of the cancer, but you think it's there, you could run, it's a blood test, so it's pretty non-invasive, then the odds of that positive truly being positive are pretty high. So it's, I think it's just being prepared, right? I mean, they're not inexpensive tests. So I think for a parent who, really wants to do everything they can, wants to be more proactive on things, money's not really an issue. I think it makes sense to run these tests. But I think if you're sort of hesitant about what you would do if it was positive, or if you want to know, or if finances are real tight, then I think I would just wait a little bit. We're still learning on these tests. So I would probably hold off. I hope
That
all that
makes
makes sense.
It does, absolutely. And I mean, I think that's I think when I was in practice and with my consulting clients still, the first question I ask them is when they've gotten a diagnosis, "Oh, my dog has a angiosarcoma or mast cell tumor," or whatever it is, the first question I will ask them is, "What what do you wanna do? Are you going to pursue conventional chemotherapy? Do you want to get options?" And, we're financially, right? Because none of the treatments are inexpensive. For sure, the testing is not inexpensive. So I think that's really critical to be clear about what it is you're willing to do, what you think your pet can handle before you pursue any of this stuff. Because then you've got this positive test sort of dangling over your mind and filling you with worry, and that's not helpful either. So that's an excellent point. One of the other things, so we live in a country of hyperbole. Um, so one of the other things that pet parents will ask me is, "Well, I don't want to put my pet through that." And we've all seen that person that goes through chemotherapy and they get sick and they stay sick and then the disease ends up taking them away. So what's I mean, you've been in this business for many years. What was your experience with the quality of life that pets would maintain during treatment?
Yes, like you said, chemo in people, it's terrible, right? Like I said, I've known people, young people who are healthy, and sometimes you do wonder how much did the disease take them versus the chemo and things? I mean, it's very rough. But in our pets, yeah, my experience has been very different. The majority of our pets do really well. Actually, about 80, 85% don't have any side effects, so they're very mild. And that's really what I see too. That's what's been published and a lot of oncologists quote, but that's also what I would see. In veterinary oncology, quality of life is number one. And a lot of that is because, their lifespan's not as long. So even if we are looking at, it's kind of a year to a dog is sort of equivalent to that 5-year survival in a person, because they talk about 5 and 10-year survival rates in people with cancer, versus our animals. We usually talk about a lot about 1 year, 3-year. That's just their lifespan. So there's that factor. The other factor is they can't speak for themselves, right? So I think everybody, the pet owner, the parent included, is a little hesitant sometimes because they can't say what they want. And so really that quality of life is the top piece for us. So I think a lot of oncologists, we try to balance that. Okay, how can we treat their disease, but not make them sick? Because the last thing we want to do is make it where they're not doing what they enjoy in and out of the vet clinic or the hospital. Like that's just not a quality of life. So, we don't push them as hard as they do in people, to achieve that.
Correct.
But yeah, and it's something that I always find people are kind of blown away by that, because your perception is always my pet's going to be sick. Even though I tell people they're not, it's hard not to imagine that. And, typically what I see is they could have a couple days, where their appetite, their energy is a bit down. But actually, a lot of these dogs feel better on chemo, which is always kind of mind blowing for people. But it's because we're treating the disease, so they actually feel more like running around or playing. And so I think that's always a real shocker for people because they just don't imagine it's possible.
Right on. Like, especially lymphoma. I mean, that's a disease. If one of my pets had lymphoma, I would treat for it with conventional means and with the means I would use, hands down, because the chance of remission, the chance of high quality of life is really, really excellent. Cool. And here's one. So we've got somebody watching from Canada, and here's the difficulty is that each country and actually each state tends to get really touchy about going over state lines and certainly country borders. So are you aware of anybody that's doing anything like this in Canada, or have you had experience working with veterinarians in Canada?
So I've definitely talked with people in Canada. Canada, you guys really don't have very many oncologists. And, when you think about the size, it's really separated out. So I haven't looked at all the logistics yet, but from what I've seen so far, especially Ontario, they are fairly open with telemedicine. That's something that they've really embraced. And it seems like it's going well. They've been kind of the poster child, I guess, that everyone's kind of following to see how is all this working. So Ontario, I think we should probably be fine. And then other areas, I'm definitely looking at it. But Canada, it looks like most of those areas we should be okay. But like you said, I literally have to check state to state because it is different. Like California, I can't. But most of the other states I can. Illinois, I can't. So it's really interesting where this is an option and where it's not. But I believe most of Canada, from what I've looked at, like I said, I haven't done a deep dive, but from what I've looked at, kind of talking with people, I think this should be possible. Because what I do is I partner with the family vet. So they're the ones that have that real relationship and done the exam. And then I'm just able to help from talking with your vet and reading through all the records, help give more of that information and help guide with the vet. So your vet is still definitely an integral piece to all this.
Right on. So we've got this link to Dr. Venable's website here. If you've got a pet that you're trying to get some answers on for what your options are, encourage your veterinarian to head over to the site. There is a section for veterinarians so they can understand what the process is, and then they can actually contact Dr. Venable and see if, logistically and legally and all that other stupid stuff, this would be a possible. And it stinks, but this is the truth, is that unfortunately various government bodies sort of regulate what we can and can't do across state borders and unfortunately country borders as well. But yeah, definitely get your local vet to reach out and see what can be worked out. Um, the and thanks for that because it is hard and it's frustrating. And you and I had a conversation about telemedicine, and it is really frustrating because it is a service that could really improve quality of care for so many pet parents, especially in rural areas. But unfortunately, the state boards and the American Veterinary Medical Association are kind of trying to put the kibosh on it for whatever reason. So that's a bit frustrating too. Um, and there's anyway, it's a lot of stupidity.
Whole nother topic there.
Whole 'nother bag of wax, yeah, and it's just, it gets so frustrating sometimes. And thanks for that explanation because I think, on the human side, it's like the oncologist push it and push it and push it until often beyond what they should perhaps, and so the person suffers. But, the dosage of the chemotherapeutics and the way we approach it in veterinary medicine is quite a bit more gentle. And there are always pets that will have side effects and will have difficulty, but I think the vast majority of pets will do very well with guidance. And especially when you're combining that with other modalities, as far as improving food, nutrition, supplements, and then that we do have to be careful about using certain supplements with chemotherapeutic agents so we don't actually block their efficacy. But I think we can help improve recovery from the chemotherapy and the disease itself using a myriad of different options. So, I think that is all the questions we've got right now. Anything I have not asked you that you think folks ought to know?
I think, whenever your pet's diagnosed with cancer, it's, it's a lot. And I think a lot of people, you just kind of freeze up and you don't really know what to do. And I think something like this, like talking with an oncologist, can just really help because a lot of times you think you may know what you want to do or you don't. There's a lot of options out there, and your family vet can usually help guide you. But at the same time, it's impossible to know everything about everything. And so I think if you're really trying to figure out, okay, I just want to know my options, by talking with an oncologist, you're not committing to doing chemotherapy or committing to aggressive therapy. We talk a lot about, kind of like, here's this option, here's option B, here's option C, and all of them are different levels as far as how aggressive or, palliative, more hospice type care too. So I think that's something to keep in mind is knowledge is really power, right? The more you know, I find a lot of clients kind of calm down because you do feel so out of control when you get this diagnosis. And then once you have more information, more good, reliable information, then you can feel kind of calmer as far as, okay, this is what I'm going to choose for my family, or this, or I'm going to choose this or that. And I think for a lot of people, they just feel more at peace once they have that information and then are able to make more of an educated decision.
And that makes perfect sense because it's an overwhelming time. It just flat is. Cool. So what's your favorite story about one of your own pets? This is kind of a weird one, but a weird question, but um,
Favorite story about one of my own pets. Um, well, I guess kind of funny, kind of not. But when I was in high school, I volunteered at the Humane Society or the Pound, walking all the dogs. And of course, I got attached. There was this little coonhound, blue tick coonhound puppy there, who was there all summer, didn't get adopted. So I knew things weren't going to go good, right? If he couldn't get adopted as a puppy, the whole no kill shelter didn't exist back then. And so I convinced my parents my dad actually convinced my dad to take this puppy home. My mother was not thrilled because we already had a handful of dogs. But so I had this puppy, and he actually, he was crazy. He was a coonhound. And he actually ended up breaking his leg. He was chasing a car and didn't win. And luckily just hurt his leg. But in my senior pictures, I wanted him to be in my pictures still. So I have this coonhound with this giant cast on his back leg. in all my senior pictures from high school. So that is kind of my.
That's sweet. Cool. That's lovely. Yeah, cool. Um, let's see, and then somebody is asking, and these are a couple of uh, sort of off. There's so much out there, like fenbendazole. Actually, I have used, and it does assist. Um, Alloforce, I don't know. Easy T, I've never found to be particularly effective. And are you familiar with either one of these modalities?
No, I don't think so.
Yeah. So, and Racheal, this is a great question because there's so much stuff out there, and this person is Racheal too. So there's so much stuff out there, and it's hard to know what is good and what is not good. And so this is where it's important to work with somebody that you trust as a source of knowledge, because Easy T, I think, has been around since the 40s or 50s, and unfortunately, it just doesn't work that well. But there are several things you can do to support your pet with cancer. And again, I think most important is exercise, getting on a good healthy diet that's low in processed carbohydrates, and then battling inflammation, if the pet's obese, getting them towards a normal weight, and then working with your local vet, working with an oncologist if that's appropriate, and getting the best treatment plan pulled together. And thanks, we're glad to provide the info for you. Cool. Any I think that's all the questions we've got. Dr. Venable, thank you so much for spending time with us. I think the more myths we can clear up, the better. And if nothing else, this would be an outstanding way for you to quickly find out what the options are for your pet, so that you've got all the bases covered. So thank you all so much. Thank you so much for spending time with us, and you all take care.
Thank you so much.
Thanks.
It's definitely been my